some of his mission trips. Amen? Okay, let's welcome Dr. Wong.
In the last 12 months, I was brought to Southeast Asia 4 times, and it wasn't really planned, it just happened that way. And so, this is Southeast Asia. Now, Southeast Asia is not Middle East, but they went through what they went through in the 70s. The Vietnam War ended in 1974. Pol Pot and the killing fields ended in 1979. So they have about 30 years to recover from that. I hope it doesn't take that long for the Middle East to recover, and we can learn from that. I've been to Vietnam 2 times, Malaysia 3 times, Cambodia once, and I've been to Thailand before. I've not been to Myanmar, but my brother goes there every year. I've not been to Laos, and so I'm beginning to learn something about Southeast Asia and what they've gone through. This is the palace, the royal palace, one of the tourist things that you do. Actually, there is a king in Cambodia. So Cambodia is a constitutional monarchy. The king is currently a Buddhist monk. So the official religion in Cambodia is Buddhism. But the Prime Minister, Hun Sen, has been there has been the Prime Minister for the past 25 years. So it's practically a dictatorship. I'll focus my talk on 2 missionaries that we sent from Joshua. They worked at Joshua, and about 10 years ago then they joined Missions to the World, which is part of the Presbyterian Church of America. On the far left is Dr. Ida Kim, and we were just visiting Mercy Medical Center. The building we're looking at is brand new, just probably a week old. They just finished. Prior to that, it was just a clinic. So there's been a missionary clinic there for many years, and recently then they raised enough money to build this building, and they're able to do surgery. They have inpatient ward, maybe enough for about 3 or 4 people. They don't have nurses, so the inpatient capacity is limited. One of the problems that I've seen, and as an outsider going in, is that they have plenty of doctors. The problem is they're all missionaries. Well, what's the problem with that? They don't get paid. The thing is, somebody needs to take charge. Somebody needs to put their neck out and make a commitment. And it's a cooperation of 4 or 5 different missions organizations. Missions to the World, there's OMF, and there are a few other missions organizations. So then nobody is really in charge. Nobody is really sticking their neck out and saying, we gotta make this work, we gotta start this place, we're gonna make this run, we're gonna take care of hundreds and thousands of people. They're afraid. So they have a facility, but not enough actions going on there. Don't know what to say to them yet. What we did is that we went to the countryside and did 6 days of village health clinic. They also have different strategies. In the past, when I go to the mission field, you see maybe 200 patients, 100 patients, as many as they can bring. We just try to hurry up, do whatever. They had a different idea, which is not bad, because they limit it to 50 or 60 people. And we have 3 US trained doctors there. So we weren't really seeing things at a fast pace, but we were training local doctors. So there were medical students there acting as our interpreters. I needed an interpreter. The other 2 missionary doctors, they're fluent in my language. And so we were actually training medical students as we see patients. So that's good, because then that multiplies the value that we provide. Kinray is my student that worked with me. And so I get to spend 4 good quality days one-on-one mentoring him. I think that if in the US I have that kind of opportunity, that would be great. To have a senior physician and working with you side by side all day long, trying to teach you things. I think his name is Bill. It's interesting. He goes around, and he's retired. He goes around on mission trip, and he not only fits people with reading glasses, he teaches them how to do it. Now, I've learned to bring about 100 reading glasses from 99-cent store. Every time before I go to 99-cent store and round up all the reading glasses for $1 a pair. But he gets it done with less than 50 cents a pair. And he goes to the mission fields and then teaches the local missionary how to make them. And that is a wonderful ministry. And this is a local midwife. She's helping us, and this little girl, 2 years old, has a cellulitis from a motorcycle accident, and I guess if there's no medical care, she runs the risk of losing a foot. And so we were able to treat the wound and give her IM antibiotics. Loma Linda University is very missions-oriented, and they sent a faculty member, Philip Jenny. She's a Korean missionary in Cambodia. And these are pharmacy students doing a pharmacy rotation in Cambodia. We also have staff working with the children, teaching them the chicken dance. Another missionary that I'm going to emphasize on is she takes a totally different route from the traditional medical missionary. She's a nurse practitioner that used to work at Joshua. But she went up there and she prayed to God to send her to a place that no missionary has been. To go to a place where there's no church. So she went to the countryside and rented a place. Before long, she witnessed to the landlord's son. He taught her Khmer, she taught her English. She taught him English. And the two together are now partners, not in the sense of husband and wife, but in terms of ministry. This is her little house. These are her disciples, 22 young men, amazing. So they lived there, worked there, and they were taught English and Bible studies, and now 17 of them are in college. I met about a dozen of them in seminary schools. 2 of them are in medical school, 2 of them are in veterinary schools. She pays for all of them. Isn't that wonderful?
That's awesome.
It takes about $1,000 a year to support a college student in Cambodia. So she has 17 children that she sends to college.
Wow.
And this is her first convert, and now he's teaching English to after-school children. So each day after school, there are over 100 students coming to her grounds, and there are 4 classes going on teaching students English. And in the process of teaching them English, they learn Christian faith. So this is her teaching high school students, so the next level they'll be in college. Every culture has its unique cuisine. In Cambodia, it's tarantula. Thank you.